All right. Good afternoon, everyone, or good morning for wherever you're joining us from. Thank you for coming to the ASPPH Presents webinar, Community Assessment and Partnerships. My name is Morgan Shire. I'm the Manager of Student and Alumni Engagement here at ASPPH, and we are thrilled that you could join us today for this exciting presentation. Quick housekeeping item before we start the presentation today. You can ask questions to the presenter using the Q&A feature at the bottom of your screen. You'll just click on that little icon and then type your questions into that feature, and we will try and get to them at the end of the event during the Q&A portion. I'm super excited to introduce our moderator for today's event, Bree Amiano. This is Public Health Ambassador and also an MPH student of epidemiology at George Mason University. So Bree, I'll hand it over to you.
Hello, everyone. I'm really excited to welcome you today to today's webinar. Like Morgan said, my name is Brianda Miano, and I go by Bree, and I am a second-year Master's of Public Health student at George Mason. Very excited to graduate in May and move forward from school. Having had the privilege of being taught by Dr. Mitcham during my community assessment and partnerships class in the summer of 2023, I can personally attest to her passion for integrating her work into her teaching materials and her commitment to fostering personal connectedness and exploring different disciplinary approaches. And one thing that stood out to me throughout her class is that she's not your typical professor. She's all about breaking boundaries and fostering connections in communities. So without further ado, I would like to pass it on to Dr. Mitcham to let her introduce herself and dive into interdisciplinary community health work.
Thank you very much, Bree, for that very humbling introduction. And I apologize, my dogs are barking in the background, so if you hear them, again, my sincere apologies. I'm Dr. Mitcham. I work for George Mason University, and I am currently the director of the online Master of Public Health program and an assistant professor there. And today I am going to talk with you a little bit about community assessment and partnerships. Now, if you are one of my students in this class, and it's a class that all of our students in our MPH program have to take, you will hear me talking a lot about not just why community assessments and partnerships are important, but how to approach them in a bit of an innovative way. So this presentation is going to be titled Community Assessments and Partnerships, Ducks, Dandelions, Dutch Ovens, and Discussions. And we'll get into the why of that title a little bit later in the presentation. So in the first slide, we see a photo, and that is me rocking a mustache at an innovative senior event. I'll be talking more about that later. But one thing that I love to do is to use a community-centric approach in any sort of public health work to get different ideas, different perspectives, so that health problems, health disparities within the community can be addressed in a creative, interdisciplinary format. So part of the reason for this comes from my grandma. And if you've been in any of my classes or if you've attended any presentation that I've held, I talk a lot about my grandmothers. I was very blessed to have two amazing grandmothers. The grandmother in this photo was a registered nurse by training. And she was one of the most incredible people I've ever had the privilege of knowing. Grandma was very community-minded. She was very connected with people. It was not uncommon at all to visit Grandma and to have people of all ages, backgrounds, experiences, just spending time with her, sitting around her table. Grandma believed that we need to be present for people, that you never know what's going on in somebody's life, and that when we make snap judgments about a person's situation, their choices, their health, we can lose sight often of the value of that person as we try to do our work. Grandma kept this approach very forefront in her mind as she worked as a registered nurse. But she also kept that forefront in her mind even after she retired from her nursing career. Grandma also said that great things happen when people work together to bring about change. She was a huge proponent of change starting at a person level. So one person connecting with another person and being present and taking the time to connect with that person. Hearing their storytelling was also very important to Grandma. Really being able to understand where somebody was coming from, identify maybe experiences that they had had that influenced their behaviors, maybe understand some of their experiences that have influenced where they were in life, never making those judgments again, but just trying to understand the person behind the health need. And by doing that, Grandma said people matter first and foremost, that any work that is done, if people don't know that they matter, if you don't take that time to intentionally show people that they matter, it doesn't matter what amazing work you do to help people, you've lost sight of the big picture and your work is ineffective. So taking that approach then into talking about health disparities and this whole community assessments concept. As we know, health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Now, we know also from working in the field of public health that some socially disadvantaged populations are, I would say, easily evident or more easily evident if we go into a neighborhood and we see that there's a preponderance of poverty in that neighborhood, where the housing conditions maybe are not optimal, where there isn't adequate food to support the dietary needs of that population, if there isn't clean drinking water, if there isn't safe, secure housing, if there aren't medical services accessible. We may make this this assumption that that might be a socially disadvantaged population, and we may be right. We also know, considering the social determinants of health, that there are many factors that influence how healthy a person may or may not be. Now, these social determinants of health are often outside of the influence of the individual who is affected by them. And we see this particularly when we're dealing with children. Children are have a lot of their decisions made for them by adults in their life. So working with children, thinking about how social determinants of health affect their livelihood, but then also thinking it in the larger context. If people are born into a neighborhood or an environment or a socioeconomic bracket, it can be very difficult to leave that known concept and then to change. So often these social determinants of health, like economic stability, education, access, and quality, healthcare access and quality, neighborhood and built environment, and social community context, we know are these factors that affect people's health. But as we're thinking about that health, there are also ways that that overlap. And when you look at professionals from each of these different areas within the social determinants of health, when you look at organizations that hire people and making sure that they have equitable pay scales, or that education is available and that it's excellent education that's available, where we're looking at healthcare, the accessibility of it, the excellence of it. We're looking at the neighborhood, not just the houses in which people live or the apartments or the condos, but also looking at the infrastructure within that neighborhood, what stores are prevalent, what activities are going on in that neighborhood. And then the social and community context, what organizations are represented within that community. So thinking about the why of needs assessments, and poor Bree is going to be hearing this again because this is, again, information that we cover in GCH 609. But needs assessments ultimately are conducted for allocation of funding. So policy drives any sort of funding that gets allocated to do certain health work. So how do we figure out who gets that available money? There's only so much of that money that goes around. How do we decide who's able to get that money when there are so many different pressing health needs that exist in our communities domestically, and then also communities overseas? How can we determine where that money should go? So we do this by doing needs assessments, identifying what are the most pressing issues, ones that potentially can be addressed fairly easily, relatively cost limited, but also the issues that we know may not materialize in actualized change right now, but if not addressed, could end up creating a problem downstream. We also conduct needs assessments to undergo program evaluation if we have these programs that are currently underway. Are they effective? Are they ineffective? Could they be improved? How can they be improved? To make sure that underserved populations are equitably represented. I love qualitative and mixed methods research. And the reason that I love qualitative and mixed methods research is that numbers can show part of the problem, but often hearing the voices and the perspectives of people affected by these issues will be able to give a better idea and concept of the scope of the problem, not just what the problems are, but the contributing factors that lead to that problem. And again, underrepresented populations may not necessarily be reflected in stereotypical demographic data collection. But when you take the time to explore those through qualitative research, then you're able to hear the voices and then make those voices louder and not necessarily hidden through the numbers. Needs assessments also help with community representation, making sure that each person in the community has a voice. And then also, and this is one of the most important things to me, is integrity. There are very good reasons, not good as in it was good that they happened, but very real reasons why there's a distrust and mistrust of different organizations or different initiatives, especially certain communities that have been historically repressed or have experienced social justice concerns over a period of time. In order to ensure that their needs are accurately represented and those needs are adequately addressed, it is imperative to have integrity embedded into every step of the community assessment process, the community strategy process, and the implementation process. So in order to do this, we first identify a problem, and then we conduct a needs assessment to explore potential contributing factors. So we know that there's a problem. Now we get to do the needs assessment to figure out what those factors are that affect the problem. Now, sometimes those can be very obvious. More often, though, they're not so obvious. So by identifying relevant partners such as community members, individuals, and organizations, and inviting all of those partners to be part of discussions, then the perspective of one individual or from one silo doesn't end up being the perspective that drives the research or drives a needs assessment. There's a more holistic, comprehensive approach that is able to take place. Then create an open discussion forums to discuss ideas and brainstorm ideas. And one thing that I found is very helpful is to have predetermined information and ideas and being willing to entertain odd ideas. So engaging community members in conversations, engaging community representatives, trusted people within the community to discuss what their perspectives are, what they feel are needs within the community, what they perceive to be contributing factors to those needs, all of those things, but also not just having it a free-for-all, having those conversations structured so that there is some, again, structure to those conversations. And then not being so, this is the way it's been done, this is the way that we always have to do it. Greatest measure of insanity is doing the same thing over and over and over and then expecting a different outcome. So I have found, at least in my limited experience, that odd ideas sometimes are the very things that may work best. So if something hasn't worked before, why try to do it the same way? Why not try something different? And then keep communicating and maintain transparency in all proceedings. Again, that integrity approach of building trust. Trust is very difficult to build. Trust is very difficult to maintain. Trust is very easy to lose. So by incorporating that integrity approach, then that community willingness to be part of the process will continue. Photo here is of a 4-H kiddo. Another strategy, and I'll be talking about this in some of the examples that I give, is identifying which community organizations are already trusted. So not just going into a community saying, hey, I'm the expert, I'm here to help you, which almost never works. And by almost never, I think probably just never works. But identifying who are the key players in that community. What are some organizations that community already trusts that has that integrity established, and then working with those communities to help bring about a change. So I'm a bit unique in academia. I'm actually fairly new to full-time academia. For most of my work, I have worked in nonprofit organizations, either helping to run a city mission that had soup kitchen, food pantry, homeless shelter. I also worked for cooperative extension for a number of years doing community engagement. So although there is the research side of it that I have learned and have brought to the table, a lot of these experiences are things that I have learned just by being out in the field, seeing what works, seeing what doesn't work. So before I get into a few quick stories to kind of frame here's the problem, here's how we want to address the problem, thought it might be helpful to share some anecdotes with you of things that I've actually heard from the field. Don't talk to me about vaccines. Obviously, people and the COVID-19 vaccine, highly polarized topics. So going into any community, trying to encourage vaccination, sometimes people just don't talk to me about vaccines. All right, so if you know that something may be helpful for an individual in a population, how do you have those hard conversations when people are just, don't talk to me about it? Do you insist, well, I'm going to talk to you about it? Or is there a different approach that can be used? I can't afford to eat healthy. That's something that I've heard a lot. Most of the work that I've done has been around the topics of nutrition and healthy living. I'm very passionate about addressing food insecurity. So a lot of people say, I just can't afford to eat healthy. And although unhealthy food is very prevalent and very more affordable sometimes than healthy food, it's not out of the realm of possibility to eat a healthy diet. It just takes some knowledge of how to turn things like dried beans or vegetables into food, cooking from scratch. Grape is a slushy flavor. This was one of the most, I think, horrifying things that I've heard in a school. I went in to start doing nutrition education for an inner city elementary school a number of years ago, and had asked the students in the school questions just to kind of gauge their knowledge area. And one sweet fourth grade girl thought that grape was just a slushy flavor, had no idea that grape was actually a fruit. Exercise, and just when am I supposed to find time to do that? Again, sometimes as public health professionals or health professionals, we have these very well-intended, well-meaning recommendations that we know will help people become healthy. But if we tell them, okay, well, you need to be healthy, you need to exercise, well, and they're working 3 or 4 jobs, or they're a single parent who can't take the time to go to a gym, or they simply don't have the mobility issues to go to a gym and exercise. How can we, again, make that exercise accessible to the individual in a way where we might be thinking outside of the box? And then ain't never gonna trust no doctor. Again, mistrust, distrust, very prevalent and for very good reason. So how do we engage with community members and have these hard conversations so that we can build that trust? Now, much as with my grandma, I find that storytelling often helps to kind of illustrate some ways potentially of doing this. And I'm not using these stories as a means by saying, hey, this worked for me, therefore it's going to work for you. But just kind of fleshing out some ideas of here were some health problems that were identified, or health issues that were identified. Here's some strategies of how the community came together, how we used an interdisciplinary approach to address these problems, how we conducted the needs assessment, and then what the outcomes were. And from this, hopefully it might spark some ideas in your work of how you can kind of think outside of the box. All right. Also, a lot of the work that I do is in rural regions. And if anyone has ever worked in a rural region or has lived in a rural region, you will know that storytelling is one of the fine arts of rural life. So because of grandma's perspective, and because of that, and just because it's more fun than just rattling off statistics, at least to me, I'm going to go into a few stories. So story 1, a group of seniors in one county has been observed by local medical and mental health professionals as expressing vocalizations of loneliness and exhibiting adverse mental health outcomes, while simultaneously also presenting as obese and overweight with a disproportionately high rate of largely preventable conditions like type 2 diabetes, cirrhosis, cardiovascular disease, and cognitive decline. Many of these residents live within the poverty threshold and distrust the government or other authorities due to heritage or personal or family history. So for this example, we have a group of seniors who are lonely. They're expressing that they're lonely. They are not gathering together as a community regularly. They're not exercising. They're not eating very well. A lot of them are abusing alcohol and tobacco. Many of them have had family members move away. And again, just that overwhelming sense of loneliness. Because they live within the poverty threshold, many of them, and because there's such a high level of distrust, all of the government agencies that come in and try to make some positive change have run into barriers and have not been able to enact that change. So in order to address this, a number of community organizations got together and brainstormed, well, what do the people and what do the seniors in this community like to do? What would draw them together? So we called a meeting with some of the seniors, some representatives from local community organizations. Again, since the governmental ones weren't necessarily as trusted, we had 1 or 2 representatives from them, but local faith-based groups, local businesses that had community type options offered, like local painting classes, local libraries, the local high school. So a lot of different community organizations that you might not think would be part of a senior conversation. So had everyone gather together, had some of the seniors vocalize what they felt, had some other of the community representatives vocalize their perspectives. We had some brainstorming back and forth. And from this, we created an approach to create community within the senior group where seniors would gather together, not just by themselves, but in an intergenerational format, and do fun things together. And these fun things would not just be random activities. These would be activities that would promote health, either promote dietary improvement or promote physical activity or help teach a new skill set or teach information that will help to improve their health. And by doing that, also improve their mental health outcomes. So one of those activities was snowshoeing. In the wintertime, snowshoeing, if there's too much snow to go outside and go hiking together or go walking, snowshoeing is a fairly low impact exercise, a lot of fun, especially when you have kiddos making snowballs and then tossing them. We also created a number of intergenerational hikes together. And again, it made me very encouraged to see that there were the sweet ladies in her 80s. She would go on these hikes, and some of them had some elevation, some of them are relatively flat. I do a lot of foraging. I teach a lot of foraging workshops. So these hikes also included some, hey, here's this plant. This is what this could be used for. Kiddos that go on these hikes, again, making that intergenerational approach, would point out things that they would see, and there would be conversations between the generations. Also teaching workshops about things like osteoporosis, holding nutrition education workshops. There's going to be a slide that I will show you at the end of this presentation with a photo of how successful this program has been. So just to kind of frame it without spoiling what that photo will be. This group of seniors went from having all of those identified health issues to several years later, several of these seniors have gone off of their type 2 diabetes medication as directed by their physicians, not due to anything that we have recommended, but they're off their medication. A number of them have had their unhealthy weight lowered. A lot of them are very physically active. A lot of them are extremely socially active. Their diets have improved. They are a vibrant community that is no longer lonely. They're encouraging each other to be part of activities just because we took the time to have that. Let's think out of the box, bring in a whole bunch of people together, do an informal needs assessment, and yes, with the empirical data as well, and then come up with an idea that works. All right, next story. Local school district has an extremely high percentage of students who present with developmental and behavioral disorders. Over 90% of the students qualify for free or reduced lunches. Many only receive regular medical and dental care through the mobile clinics that visit the school. And more than 50% of the students live in homes where substance and physical abuse are known as regular practices. Funding for the school is limited. This particular school, I could say that those percentages of the home environments are low. The percentages are actually much higher. The kiddos in this school have struggled to be kind to each other, and not just polite kind, but I'm talking like no physical violence when they're around each other. Many of them have shown up to school filthy. The local social services department has been taxed. They go back into these homes and are unable to really afford much of a change. So these poor children, and I'm not meaning poor as in income, I'm meaning poor as in my heart really broke considering the situation in which a lot of these children lived, would go from not great home environments to school and then almost not be set up for success in the school because of everything going on in home. They simply didn't have the knowledge and the tools and the resources to be able to make those choices that would improve their life. So school scores were very low. Again, there were a lot of behavioral issues. So what we ended up doing was having, again, those community meetings where you have that empirical data from which to draw, and then talked with some of the teachers, talked with the social workers, talked with a few of the grandparents. It was more grandparents than parents that were involved in some of those conversations. A local faith-based group, local coaches had those conversations of, okay, well, we know there are all of these problems that are presenting. We can't go in and change the children's home life. What can we do to give these kids a fighting chance? So we came up with the idea of applying for a grant to fund an after-school program for these kiddos. And the grant had in-kind donation. If anyone's done any sort of nonprofit grant writing, you know that in-kind donations are a wonderful thing when you could show that that is matched in the grant. A lot of different community organizations volunteered their time or volunteered materials in order to make this an actuality. So from that after-school program, the school ended up funding teachers and aides to stay after 5 days a week. 4 days were academic support and then snacks. There was also food provided, also a backpack program so the kiddos would be able to go home with some extra food. Another local organization donated things like clothing, hygiene items. And then 4-H, the local cooperative extension youth arm, was hired to come in and provide other education 1 day a week. It was glorious. I was able to go and be part of that since I had been part of the original grant writing. And we did everything from nutrition education. I would make smoothies with the kids using whole foods. We would make hummus in a blender. We would talk about fresh fruits and vegetables and grow things in a garden and then translate that into actually cooking something. But we also did things like positive youth development. And one of the strategies that I'm most proud of is I had told the school I wanted to bring in small animals, that these kids didn't know from living in their home environment how to appropriately handle something with care and with kindness. So we brought in animals one of the days so that the kids could learn how to kindly pet a dog and how to kindly hold a chicken and all of that stuff. And from that positive youth development work and playing games together and going on these little hikes and nature walks and all of these other activities, building forts, all of these fun things that kids should be able to do. Within a few years, the grant ran for about 5 years. Within 5 years, this group of kiddos whose scores had been awful, who were fighting in during the school, who were constantly filthy, not having any good hygiene. Did it fix everything? Absolutely not. Are the problems still there? Absolutely, yes. But seeing some of those children take ownership of being leaders in the group, show kindness to others, ones that had been bullies before, preventing bullying in others, learning about the benefits of eating whole foods, being excited when their backpack program had a soup mix that had beans and lentils and things like that in there because they had made one and cooked it with us in one of these workshops and then realized that they could actually cook food for their family. Night and day difference. That grant did run out. We're looking at reapplying for it. But again, just one example of how people working together, identifying what some of the factors are, can make a difference. Here are some examples of games that we did. So again, you're not just doing things outside, although that is fun, but also doing things indoors as well. All right, next story. Community members in one city expressed their desire for safe outdoor spaces for them to walk, for the children to play, and for people to safely ride their bicycles for transportation. Many of these residents present with obesity and overweight, type 2 diabetes, cardiovascular disease, and most of these residents fall within or below the poverty threshold. The director of the local Department of Transportation states that the DOT does not have room in its budget to support new infrastructure changes. So another one of those needs assessment, gathering secondary data to look at the infrastructure, to look at potential costs of what it might be to make some of these changes that the community members wanted. Once all that data had been gathered, we called together another community meeting, got representatives from the beautification committee for the town, which I didn't even know what was a thing, but apparently it is, the local school district, the senior center, the local senior group, the local disability group had some representatives from the vision impaired community come. We had, again, Boy Scouts, Girl Scouts. We had just a really nice snapshot of a lot of diverse groups and individuals from the community. Had a meeting, heard some of the concerns, and the concerns weren't just the safety of the neighborhood in general, although that was part of it, but also the safety of riding a bicycle on a road where a lot of people drove, or not having excellent sidewalks, or not having places for bicycles to be locked if people did ride their bikes. So we ended up having that meeting. I put together a proposal, wrote a grant, and got Mark Fenton, who is a public health expert. If you have not heard of him, you need to look him up. He is fabulous and dynamic. And he is an expert in built community design to encourage people to be more physically active, and for people who drive to be able to do so safely. So we wrote the grant, got Mark to come. We did a walk audit where one representative from each of those community organizations walked with us throughout the community, and we identified things that might need to be changed. So there was one crosswalk. I was modeling is it safe to walk this crosswalk? There were a lot of accidents that were identified as being in this area, and a lot of children that were attempting to cross the road had some close calls. So this intersection was identified as being problematic. Another intersection was identified as potentially benefiting from a roundabout because it was very congested. Other recommendations that were made were to have extended curbs so that people crossing the road might be able to see traffic that was oncoming, to improve the paint of crosswalks so that people who are visually impaired might be able to feel the raised bits of those crosswalks. Also to put benches every so often so that seniors or people with mobility issues could take rest if they were walking, to put shade so that people wouldn't end up overheating, to make sure that there were bicycle racks put in so that people who would ride bicycles would be able to have a safe place to put them. A number of different recommendations, narrowing different parking lot entry and exit so that there wasn't a ton of traffic in an area where children would be trying to walk across. And then one other recommendation was a walking school bus, where instead of parents driving their children to school, where different volunteers in the community, and again, this is where a lot of grandparents stood up and offered to help, would walk with kids in a very large group together to and from school every day. So we had that walk audit. We worked together. We came up with a proposal. We worked together to get funding. The DOT said that certain of our ideas couldn't happen right then, but that they would allocate funding when, like, for example, the sidewalks were due to be repaired in a year, that when that happened, they were going to make sure to implement some of what had been changed. COVID happened, so a lot of these changes ended up being halted. Most of the biggest ones that we wanted outside of the roundabout, that one did not yet happen. But the walking school bus and some of the other ones took place, and now this community has more people walking, has more people bicycling. There are bike lanes in the road. There are ways for people to be able to safely move throughout the community, not just without getting hit by a car, but also making sure that they're walking together as a group. Again, that sense of community, having those conversations, making sure that people are healthy and happy and take ownership. All right, last story. Food insecurity is prevalent in one rural metropolitan fringe community. Many residents are underemployed, either as seasonal workers or as workers in low-paying, physically demanding, and dangerous jobs. Many also do not qualify for governmental food assistance and will not accept food from local food banks. High rates of alcohol, tobacco, and other substance use and abuse are observed in this community. Many residents are obese and overweight and present with comorbidities. All right, so rural metropolitan, you have access issues. It's very difficult to be able to go somewhere to get groceries. It's also difficult to afford groceries because things that are transported longer distances often are higher in price. The quality of fresh produce in those areas in the grocery stores are abysmal. There's sad and soggy lettuce and things that I would not touch with a 10-foot pole, and I love to eat plants. There are so many different factors. Food banks, not even close to where these people are, so making that more of a challenge also. Thinking also that a lot of these people are working multiple jobs, so they don't exactly have time to grow a garden and to be able to take care of themselves that way. But it's not just food insecurity. There are also a lot of abuse of substance issues that kind of correlate with this. And again, as you see with a lot of these communities where you have all of these multiple layers of these issues, many of the residents were also obese or overweight and unhealthy weight. Again, we all come in beautifully diverse shapes and sizes, but there's a difference between being a healthy weight and being an unhealthy weight. So a lot of these residents were also an unhealthy weight and presented with comorbidities. And this is where the ducks, dandelions, Dutch ovens comes in with the discussions that we've already talked about. So had another community discussion, did some empirical research, and then came up with some creative, innovative ways to increase not only teaching about what healthy food looks like and how can you be more food insecure, but to do it in an experiential manner where people were engaged and they would be learning skills. Again, something to tell somebody, yeah, carrots are good for you, eat it. They're not going to eat it unless you work with them to say, okay, this is why they're healthy. Let's work together to make something with these carrots. Let's try it together. And then you see if you like it, maybe you'll want to eat carrots afterwards. So yes, I know that these are not ducks, but we did at the cooperative extension office at which I worked said, okay, cooperative extension, why don't we have gardens? Why don't we have animals? So we hatched chicks, we had chickens, we had ducks. There really were ducks. I just couldn't find any photos of them. And then showed community members, if where you live allows it, here are some ways where you can get fresh eggs if you eat eggs. These fowl are fabulous to be able to eat ticks. That's also another benefit. So we show them if you live in an area where you can have this and it's something that you want, here's a way where you can increase your protein consumption. It's also a great skill set for kiddos to learn how to handle animals, helps to keep ticks down, all that good stuff. Also worked on teaching foraging workshops. It's something that my family has done, and it's something that I do. I do a lot of foraging walks and, just identifying what plants are used historically for medicinal purposes, but also food. So teaching them that, yes, dandelions, if you live in a neighborhood that has an HOA and doesn't want what are called weeds popping out in your yard, might not be okay. But if you're in an area where there isn't that problem, dandelions are fabulous. And they also provide pollination for honeybees early in the season. So you could eat them and make the bees happy. It's like a win-win-win. And then I also wrote a 4-H outdoor cooking guide. It's like a curriculum / recipes. And my thoughts were, I love fire. I love food. Fire and food might make people more willing to try to cook from scratch. So created this. That's my kiddo right there. And then worked with a lot of different groups in the community, both youth and adults, to teach them, okay, if you're going to do something outside with fire and food, here are some recipes. Here are how we can learn how to do it safely. All right, so lessons learned. Innovation and collaboration are key. Again, transparency and integrity are two of the most important factors that I believe should go into any sort of community assessment or any partnership work. Again, trust takes forever to build, very, very easily lost. So mistakes do happen, oopsie moments do happen, but if there's transparency and integrity throughout the process, then that trust, once it's built, will enable other organizations to come in and continue building on that work that's already been done. I also love using the Lara method of communication. Again, a lot of these conversations are tricky. So listening, affirming, responding, and then asking questions so that the person with whom you're speaking feels that they are heard, that you're showing that you're actively listening because you're repeating things back to them. You're asking them questions, so maybe they could adjust their thinking a little bit, and you're not necessarily agreeing with them, but you're keeping that communication open. Also, weird ideas work sometimes, even if outcomes are unexpected. Dumpster fires can be a good thing. And for that, there's a photo right here. Story behind that, very briefly, did some work with a group of high school students who have a variety of different developmental behavioral disabilities. And I had gotten permission one time, I'm hoping to be asked back, we'll see if it happens, to do an outdoor cooking workshop with these kids. And it was glorious. They prepared food. I brought some random items and like, okay, well, what do you want to make with this? So we came up with our own recipes, and all of these kids that typically struggle greatly in the classroom, not only just with their academics, but with a lot of other things, were actively engaged in preparing food for themselves. They cooked it, they ate it, it was great. I see that little green Coleman stove. So hot coals were left afterwards, and I was told that I could pick that container up the next day. One of the teachers tried to help and dump the ashes into a dumpster. So at the end of the school day, there was a literal dumpster fire from this effort. And it was funny because everyone talks about I'm the dumpster fire lady. But it was a symbol to me of something that was successful. The kids talk about dumpster fire lady and the dumpster fire day, but how much fun they had. And some of them had their parents or grandparents come and help out. And it was just another example of doing a needs assessment, seeing that there are these problems, but how can we address them in a creative way, get everyone involved. And then even when something unexpected happens, something good can come out of it. And then also being willing to look silly works. I have zero shame when it comes to doing anything. As you can see, there's another photo of me with my mustache. This is from last year. I consider myself a community health cockroach. I will go in, do whatever, go wherever. I just want to be able to make sure that what I'm doing makes a difference. And I'm willing to look foolish if that's what it'll take. All right. This is the slide I told you I would show you from that senior group. We do a murder mystery luncheon every year in March. This was a photo from last year. This has been running for 4 years now. And when we first started, people thought it was a crazy idea. And the rationale for how this got started, this is the same senior group that we're trying to get engaged and improve their mental health outcomes and their holistic health outcomes. And I was doing a workshop in March about heart health and cardiovascular disease. And I said, well, if your heart doesn't work, you're dead. So why don't we do a murder mystery? And they're like, okay. So we had the lecture on cardiovascular health, and each year we do a little bit something different. This year I'm talking about the Mediterranean diet. And then afterwards, that captive audience who's there for the lecture gets part of this murder mystery. So to put it in very brief perspective, a lot of senior centers struggle to even get 5 people in the door for events. Last year, there was a 3-foot snowstorm the day before this event, and we had a max of 80 people. We had capped it at 80 people, and they all showed up for this event. This year, the event, so I want to say sold out. They charge, I think it's like $5 per senior to come to this event. And they sold out within 2 days of the event being open, and it's been capped at 90. So we're trying to squeeze as many people as we can in legally and safely. But that's just, to me, an example of success of we knew that there were problems. We did that community needs assessment. We knew what the data had to say, but then we also included conversations from the people actually affected by those issues. We collaborated together, and now several years later, you have over 80 seniors showing up for an event that they look forward to every year. They laugh, they have fun, they ate healthy food. They're just being a vibrant, wonderful community, and I get to wear a mustache, which is good. All right, thank you for listening to me talk for the last huge bit. If you have any final thoughts, I'm open to questions. And then if you think of something afterwards that you didn't want to ask here or didn't have a chance, my email address is mmitcha2@gmu.edu. And again, thank you very much.
Thank you so much, Dr. Mitcham. That was a really good presentation. It took me back to that summer class that I enjoyed so much. We do have a couple of questions, so we'll just go ahead and get started with those. The first one is, what kinds of careers can you have in community health?
Oh, that's an excellent question. So I tend to think of public health touching pretty much everything. So when I think of community health, I think of everything from working with seniors at a senior center and encouraging them to be physically active, to going into schools and working with kiddos in schools, whether it would be, the importance of hand washing or nutrition and wellness. Community health also can involve working with different marginalized groups to help promote accessibility and help to address some of those social justice inequity issues. Community health can also include, I don't know, pretty much anything that involves the community and helping them be healthier. I've known people who work for, again, soup kitchens, city missions, charitable agencies that go in and do community work, ones that run community gardens, ones that help with ensuring that clothing drives get conducted, going overseas, doing a lot of water cleaning work and nutrition, food education over there. So it's really as diverse as people want it to be. If it incorporates teaching people how to do something that will help them be healthier, then it falls within the umbrella of community health.
Thank you. I know you mentioned it briefly that you used to work for nonprofit work before going into academia, but what factors drew you to this kind of work?
So I had taught as an adjunct for a number of years while I was working in the community, and it made me twitch a bit sometimes when what was being taught in the classroom didn't necessarily translate out in the field. And like, okay, well, I've done this work and that sounds good on paper. That's not going to work. Or, thinking about working out in the field, and if people hadn't had recent education, they didn't know maybe some of the things that had changed. So I really wanted to use my experience for what it's worth, to be able to help bridge that gap between what's taught in the classroom and then what happens in the field. And not only help to be involved in research that helps to inform practice and, best practices, but doing so from a perspective of somebody who actually has to do that work sometimes. And then wanting to make sure that students are set up for success, having all of this education that you put all of this time and this effort into, you don't want to just have a degree at the end of the day. You want to have a degree that'll help you get a job and do something. So really wanting to be able to help students know, okay, here's the information that'll help you. Here's how it translates into practice and it'll help you. I can't wait to see what you do.
Okay, so we have a couple of questions in the Q&A. One of them is, as an undergraduate student majoring in public health, how do you recommend I get involved with jobs to get hands-on experience?
Volunteer. Volunteering is one of the best ways to get experience. You're doing good, which is also good for tax write-off, depending on for which organization you volunteer. But the more experience that you can get as a volunteer, you're not getting paid for the work often, which means that if you don't like it, that's a great lesson that's learned. It's not something you necessarily want to pursue as a job after you graduate. So volunteer for as many different organizations as you like. You'll see what you do like, you'll see what you hate, and then that will help shape kind of your direction of where you want to go after you graduate.
Perfect. We actually have a couple more in the Q&A. The next one is, do you assess the SODH/SWOT of an area organization based on the program that you want to establish? And once you find the gaps, do you try to assess the organizations that could help fill those gaps?
Yes and no. So I love conducting SWOT assessments. And so if I'm going to do an evaluation of a program that's currently existing, I will look at that organization, do like a basic SWOT analysis, see what's working, but then also see what is an overlap assessment with what other organizations in the area are doing. So not just looking at the functionality of that organization, but also comparing that with others, seeing how those areas could be strengthened, seeing how there maybe be able to be some improvements. One thing that I've done regularly in nonprofit work is doing needs assessments, not just of the empirical literature, but also gathering community input every 2 years or so. So not assuming that anything that might seem to be working well is actually working well. And again, for anyone who's worked in the nonprofit field, those pesky grant reports or the end of the year nonprofit reports can be such a pain in the backside, but they're helpful in identifying, here's what we started the year wanting to do, here's what the grant said we were going to do, here's what actually happened, and then figuring out from that, being able to how to make some of those improvements as well.
Okay, the next question is, what is the LARA method?
LARA method is listen, affirm, respond, and ask. So it's a strategy that I use when working. It's really helpful for talking with people in general when people don't always agree. And let's face it, we're human beings. We never agree with everyone all the time. But especially in trying to have that connection with somebody, I don't want to talk at somebody. I don't like being talked at. And I want to make sure when I'm having a conversation that I'm hearing the person, like their intent as well as what they're saying. So the LARA method, L, listen. So an active listening, not listening to think of what you're going to say next, which is something I struggle with more than sometimes. Affirming, so saying something that doesn't necessarily affirm the person's perspective, but affirms them as a person. So then R, responding, and then A, asking. So a quick example of that might be if you're having a conversation with a coworker about the fact that they steal your lunch all the time, or they don't steal, you don't know that they steal your lunch, but work boundaries around lunch. So the L, listen, you could, bring it up to them and like, hey, bothers me that you're eating my lunch. And then they will say, well, you never label your lunch, blah, 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 blah. Okay, you've listened. Affirmed. I am so sorry that it sounds to me like you feel that it would be helpful for me to label it, or you didn't know that it was my lunch. And so that's the affirming and then kind of response. And then A, ask a question. Is there something that would you think it would be helpful if I labeled my lunch and then you wouldn't get it confused? Okay, silly example, but that's kind of a strategy in public health work and any community work. It's especially helpful when you go into a community where they might be very resistant to any sort of outsider, and then giving them the opportunity to actively be heard.
Okay, and then we have another one. Can you share any resources for new/small nonprofits that are looking to conduct community needs assessments on a minority community and would love to get some guidance on the different research methods?
Fabulous question. So for doing any sort of needs assessment for any sort of group, again, as I mentioned earlier in the presentation, for ones that tend to be underrepresented, this is where I love the mixed methods research. So I will usually go to county rankings and then look at demographic information. That's a good start. I will also look into some of the other factors, contact community groups that might have a more accurate factor on things like single parent households, grandparent headed households. Schools have information often on the number of students who are free and reduced lunch. So again, you got that demographic data and then collecting data from other sources to kind of fill in those gaps. Once that's conducted, then going in and actually interviewing people in the community to get their voice, and then using a mixed methods approach is very helpful. But again, starting with kind of that county rankings approach and then looking at any that secondary published data that you can find online, usually at least starts establishing the framework for, okay, well, this is what the numbers show. This validates that there's a problem. Now we can go on from there.
Thank you. We just got another one. Could you be able to share some information on those grants you applied during those CHA-CHIP periods?
I can't share the actual grants, but so some of them were local. Not local. Yes, they were local. So some of them were private grants. So a combination of public grants and private grants. Some of them, one of them was a USDA Farm to School Initiative grant that helped to fund some of the food insecurity work. Some were funded through local private organizations that had like a cost matching grant. So typically for any sort of grant work or grant research work, I look at the type of work that I'll be wanting to do, where that work is located. For example, if it's in a rural area, there might be a different data set to be able to draw from grants than an urban area. And then, or if it's like a school garden, there are a ton of grants for that. And then I'll look at the private and the public. I have found in nonprofit work that often going for a lot of smaller private grants and then using those as kind of the justification for larger public grants works very well. But also being willing to have those community partnerships already established so that if there is that cost matching option of, okay, well, you need to have a 50% in-kind donation match, then you already have that organization saying, okay, we'll be willing to volunteer our time or whatever it is.
Okay. Another question that we have is, what would you say what coursework is most relevant to community health?
Oh, that is a horribly biased question to GCA 609. Any courses that can be taken that would involve not just the science behind it, but again, some strategies for being useful in the field and things so classes that would cover topics like how do you, communication, very important for working with the community, or grant writing. Grant writing, if you work for a nonprofit, is incredibly important skill set to have. If you work in academia, it's an incredibly skill set to have. So thinking in not just the strategies for how do you translate this information into practice. That's another thing too, of how do you take this really high level language and these high level concepts and repackage them. Again, if you've been in any of my classes, you probably heard me say a million times, I really dislike the concept of dumbing down any concepts. I find that kind of revolting. So talk about repackaging. So you could teach the same concept to a highly educated professional that you could to a marginalized senior, that you could to a child. You just have to repackage it and maybe only share certain aspects of it. So a community health course that would cover learning how to do that would also be extremely helpful.
Okay, and then one final question. I know you mentioned the challenges you faced through each of those stories that you went through, but what are some immediate challenges based in community health work?
I think one of the biggest challenges, at least from my perspective, would be becoming discouraged that the scope of the problem sometimes can seem very overwhelming. And when you're doing the work to address any sort of health problem, sometimes you don't see results right away. That senior group that I won't even use the senior group, I'll use that group of students. It took about 3 years working in that school, 5 days a week of that work being done for there to be any real change being evident. So just in any community health work is powerful. If you can remember that just even if one life is changed, one person's health is improved, that's a success, and not necessarily worry about the other statistics that would say otherwise. You never know what change that will lead to down the road. One person having a changed life and changed health and changed knowledge will be able to influence others. So that ripple effect is going to end up being much larger than you might realize at the time.
Okay, we just got one more question in the Q&A. Have you done any community work with international communities? And if yes, how would it compare to locally?
I have a little bit trickier just because there are far more moving pieces and it's not as easy logistically to go there and to kind of get that boots on the ground experience. But it's also been rewarding, and technology has enabled some of that to happen where, before it would have to be like you'd actually have to physically go there. But having the ability to have like these type of webinars or meetings and actually see what's happening. A colleague of mine is heading over to Kenya actually next week, and she helps to run a nonprofit to support the needs of some disabled kiddos at a school over there. And because of the power of technology, the students in my current GCH 609 class are going to be able to help create some initiatives around improving hygiene for those students. So again, that distance-based work overseas is a bit more challenging, but it can still happen. You just have to kind of think outside of the box.
Okay, thank you so much, Dr. Mitcham. I'm gonna pass it on to Morgan for some closing remarks.
Yes, thank you so much, Dr. Mitcham, for joining us today. That was a super engaging presentation, and I hope everyone who joined us today got something from that as well. I have put in the chat the event page. We will post the recording of this event on the event page, as well as the ASPPH YouTube page. Check out our other ASPPH events that we have coming up. We do these webinars quite frequently. So if you're interested in joining more, definitely check that out and follow us on social media. This is Public Health on Instagram, Facebook, and LinkedIn. But thank you both again. Thank you, Bree, for moderating today. And I hope everyone has a lovely Valentine's Day and a great rest of your week. Thanks, everyone.